I'm Jonathan Nelson for the Texas Academy of Family Physicians with a special report on Medicare. The program provides health coverage for 43 million elderly and disabled Americans, some of whom may soon find it increasingly difficult to get the care they need.
The Centers for Medicare and Medicaid Services have proposed a 15% cut in physician payments over the next 2 years. What's worse, the Medicare Board of Trustees projects that if the current payment formula isn't fixed, physician fees will be cut by about 5% each year until 2016. That's a 40% cut over 9 years.
In a program that frequently doesn't pay physicians enough to cover the costs of the services they provide, these cuts will surely force physicians to reduce the number of Medicare patients they can afford to see.
What that means is it's going to affect my ability to pay my staff and to keep the people I've got working for me. And then it means I got to make hard choices about what patients I'm going to see.
Those 30 or 40% of the patients take up probably 60% of my time. And if on the one hand they're taking more of my time, and on the other hand I'm not being reimbursed fairly for them, it becomes a real quick time before this is a diminishing returns, and you just can't support a practice doing that.
The proposed cuts are the results of a flawed payment formula designed to control Medicare spending and utilization by restricting payments to physicians. The Sustainable Growth Rate, or SGR, sets an annual spending target for physician services. If spending exceeds that target for the year, Medicare reduces payments to physicians to make up the difference. But cutting physician fees doesn't decrease patients' demand for services. And as the nation's aging baby boomers begin to enroll in the program, there's no question that demand is on the rise.
With an aging population, you're talking about, hundreds of thousands of patients with Medicare alone who will have no access to a physician at all.
There will be fewer points of access for them because there will be fewer people that will accept Medicare.
Since most health plans base their fee schedules on Medicare rates, the projected cuts will drive down physician payments by private insurers as well.
The payment for Medicare is really what the insurance companies mark the mark from. And so if Medicare starts cutting the payment, I think insurance companies are going to look at us and say, well, we need to cut because you're doing this for Medicare, then you need to be doing this for our people too.
Several recent studies have shown that in areas where primary care physicians provide the majority of care, Medicare patients receive higher quality care and better outcomes at a lower cost, potentially saving billions of dollars in the Medicare program. That's why your Academy is working together with AAFP to make sure Congress fixes Medicare's flawed payment system so that America's senior citizens have access to the care they need.
We need to go to the policymakers and say, look, we've got a problem. We can't continue to survive in certain areas if we don't have appropriate reimbursement. But as physicians, we can't forget that we're there for our patients first, and we've got to take care of them.
For more on what your Academy is doing for you, and to learn how you can get involved in the fight for family medicine, log on to the Academy website at www.tafp.org. Reporting for the Texas Academy of Family Physicians, I'm Jonathan Nelson, and this has been your Academy in Action.